In this feature, we look at the benefits of globally authorized monoclonal antibody treatments, along with some potential safety concerns and challenges in implementation. As countries continue to roll out vaccines to prevent COVID-19 and achieve herd immunity, scientists continue to work on developing treatments for the disease. How do monoclonal antibodies work? The body's immune system generates antibodies as a defense mechanism against unfamiliar molecules. The scientific term for such unfamiliar molecules is antigens. Molecules from bacteria and viruses can act as antigens, prompting the production of antibodies. Antibodies bind to antigens. This tells specialized cells of the immune system to kill the invading pathogen. The bodies of the majority of people who recover from COVID-19 produce antibodies to the severe acute respiratory syndrome coronavirus 2. Scientists have found that these antibodies persist for at least 5 to 7 months after the infection. However, scientists can produce these antibodies in a laboratory setting to be infused into the blood. Antibody treatments in themselves are not new. Healthcare professionals have used monoclonal antibodies, for example, to treat viral infections such as Ebola, trusted source, and HIV. Each monoclonal antibody is specific to its matching antigen. For COVID-19, there are several authorized monoclonal antibody therapies. The coronavirus spike glycoprotein, which sits on its surface, functions to facilitate the virus's entry into the body's cells. Some COVID-19 antibodies bind to the spike protein and prevent the virus from entering the cell. What is the eligibility criteria for antibody treatment? Healthcare professionals currently administer monoclonal antibodies via intravenous infusions in specialized medical facilities. As noted in the clinical trials, most of the treatments work most effectively for non-hospitalized patients in the early stages of COVID-19. Currently, the FDA authorized treatments for mild to moderate COVID-19 in patients at high risk of progression to severe disease. The FDA defined this as meeting at least one of the criteria. The criteria include: number 1, being older than 65 years, number 2, having chronic kidney disease, diabetes, or an immunosuppressive condition, number 3, being older than 55 years and having cardiovascular disease, hypertension, chronic obstructive pulmonary disease, or another chronic respiratory disease, number 4, having a body mass index BMI equal to or greater than 35. Number 5, being aged 12 to 17 years and having a BMI equal to or greater than the 85th percentile for one's age and gender. Sickle cell disease, heart disease, a neurodevelopmental disorder, medical-related technological dependence, asthma, or another chronic respiratory disease requiring daily medication.